This is the Aware Families Podcast, a show that brings you a science-based, practical look at how to use the principles of functional medicine to keep your family healthy. Welcome back, everybody, to this edition of the Aware Families Podcast. I'm your host, Dr. Tom Flass from Functional Medicine Associates in Montana. So we're going to switch it up again a little bit today, just because things have been really crazy in the office lately. So I'm going to be doing a solo podcast today without Brittany. So it'll be a little bit different than our usual format. And I just got back from speaking at actually a series of conferences, but the most recent one was the Rocky Mountain Childbirth Conference down in Fairmont, Hot Springs, and was asked to give a couple talks down there to that group of folks, and it was a great conference. And so I spoke on a couple things, but one of the lectures I gave was a review of breast milk and how we really should be using breast milk as the main template to inform how we improve and choose infant formula if a mom can't breastfeed or needs to supplement breastfeeding, which I think is a pretty appropriate topic given that we're gearing up on a national level for the first time in 40 years to overhaul US formula regulations and try to improve the quality of the infant formula that's being made in the US. So we'll talk a little bit about that on this podcast, but I just kind of wanted to do a review and go over just some of the nuts and bolts so that if you are either pregnant or have a young child and might be breastfeeding or know anybody who is, this can be some useful information informing, because not only will it inform, I think, choices for formula, but also what you eat when you're lactating, because that actually can have a significant impact on the quality of the breast milk. And we'll talk about that a little bit today too. So this really fits in that concept of the whole first 1,000 days that we talked about, I don't know how many podcasts ago, it was quite a while ago, but just to kind of review that, it's really a movement, I guess, as much as a concept. And being that the first 1,000 days, which is 270 days of pregnancy, 365 days the first year of life, and 365 days that second year of life, equals about 1,000 days. And that is the most influential time for impacting a child's future health, literally for the rest of their life. So not just in that early childhood developmental stage, which is, obviously hugely important, but through the process of epigenetics, through the process of developing that baby's all-important gut microbiome, which is the important bacteria and the species that live in their gut, is heavily impacted and formed during that phase. Obviously, brain development, we go from an egg and a sperm to 85% of an adult-sized brain by the time that child is 3 years old. So an incredible amount of neurodevelopment going on. And then this is also the most influential period for something called epigenetics, which is how we can kind of turn genes on and off with these processes like acetylation and methylation, not to get too nerdy into that part of it. But epigenetics is really one of the hottest fields of medicine because it's not just your genes, but it's what might be either activating or silencing those genes, which really ends up informing what is going to happen with that person's health. And so you want to epigenetically program a child for good health. But unfortunately in America, the way that we're eating and sort of these multi-generational effects that we're seeing in the environment that we're raising our kids in, we are epigenetically programming our children for ill health, for metabolic dysfunction, for type 2 diabetes. And so this first 1,000 days is vitally important for trying to do everything we can to try to prevent some of those processes from happening. And so I really always, again, kind of break the important role of nutrition in that first 1,000 days to feed the brain, feed the gut, and feed the genes. So feed that baby and that child's brain development, feed the gut, meaning the gut microbiome and developing a good, healthy gut microbiome, and feeding the genes, meaning you want to epigenetically program that child for future health. And so when you look at that kind of process, obviously pregnancy nutrition and the pregnancy environment, hugely important. And then what we're going to talk about today is that sort of next phase with the baby's born and the baby starting to eat. And how does that impact that feed the brain, feed the gut, feed the genes concept for the first 1,000 days, which really, when we look at it, it speaks to how unbelievably amazing breast milk is for a child. And again, when I talk about this stuff, this is not by any means going to be a judgment of if somebody can't breastfeed, but I really don't think that moms or mothers to be are fully informed with how really how important that breast milk can be for promoting health in that child. And again, why we should use everything we can scientifically to make the formula match breast milk for all the amazing things that are in breast milk. So when we look at sort of breast milk versus formula fed children, there's some clear differences. So for example, well, I guess if we back up and say, like, why is breast milk nature's most perfect food for the child? Well, it's really actually not just a food source for that child, but it's a dynamic, interactive communication system between the baby and the mom. So literally, the mother's body will sense what that baby needs and be able to alter her breast milk in order to meet the needs of the child, which is pretty unbelievable. It's perfectly nutritionally balanced to meet that baby's needs until 5 or 6 months. Obviously, this is if it's a term child, premature infants, there can be some other steps that need to be taken to kind of to replenish some of the nutrients that were lost, especially in that third trimester when there's a lot of nutrient accumulation by the child. And so a baby that's born premature might not get as much iron, as much of some of these other nutrients. And so we might need to change the formula. We're not going to really talk about that today as much. But just generally for a term child, breast milk, perfect food, nutritionally fully balanced to meet that baby's needs until 5 to 6 months old. It trains and boosts the child's immune system. It is the perfect food for fostering that baby's brain development. Again, it changes over time to meet the baby's needs. And so the recommendations by some of the big governing bodies like the WHO, the World Health Organization, and the American Academy of Pediatrics are exclusive breastfeeding. And the AAP says exclusive breastfeeding for the first 6 months with addition of complementary foods until about 1 year, at which time you can choose to maybe wean. The World Health Organization extends that out and say breastfeeding along with the introduction of age-appropriate complementary foods until 2 years of age, largely because of again, those immune benefits and some of the other things. So when you look at the breast milk benefits, so immune system-wise, huge benefits. So a 3-fold reduction in hospital admissions for respiratory infections in babies that are breastfed versus formula-fed. 75% reduction in the severity of this nasty virus called RSV, which goes around it's kind of like fall, winter into spring is typically the peak seasons for it. And it even has been hitting adults pretty hard the past couple of years with whatever variants are going around. But especially in an ex-premature infant or even in a term infant, it can be one of those causes that the child needs to get admitted to the hospital. They're having trouble breathing. They need oxygen. So 75% reduction in the severity of RSV for a baby that's breastfed versus formula-fed. 50% lower chance of ear infections, 65% lower chance of getting a gastrointestinal infection, a 77% reduction in the risk of this nasty intestinal inflammatory condition called NEC, or necrotizing enterocolitis, that can really hit the premature infants hard. It can happen with term infants too, but especially for premature infants, it's definitely something that is best avoided. And then looking in the future, somewhere between a 27 and 42% reduction in the risk of that child developing asthma, which is pretty significant. And then when we look at some of the other benefits, the metabolic and neurologic benefits, so there's up to a 30% lower risk of obesity, up to a 40% lower risk of developing type 2 diabetes in breastfed infants and children versus formula-fed, improved neurodevelopment, meaning brain development, brain functioning, academic scores, things like that. This is a little bit controversial, but it looks like there is a persistent signal that there is improved brain development, and again, improved sort of cognitive functioning in children who are breastfed. Reduced risk potentially of type 1 diabetes and celiac disease, 36% lower chance of that sudden infant death syndrome, or SIDS. And for the mom, there's benefits too. There's getting close to a 30% reduction in risk for breast or ovarian cancer for moms that breastfeed for a significant duration for that child. But again, there's for a whole host of reasons, there's 1 in 5 babies in the U.S. aren't breastfed at all. Less than half the babies are exclusively breastfed by 3 months, and only a quarter are exclusively breastfed by 6 months. and a lot of women don't breastfeed as long as they intended for a host of reasons. And so I think there's multiple reasons for this, but we really, again, with those immune benefits, with those metabolic benefits, the brain benefits, I think as a society, especially as a medical society, we really need to be supporting breastfeeding as much as we can. And again, we also need to be making sure that formula, as the science advances, that we kind of advance the formula to really as closely match breast milk as possible because of those benefits and try to close that gap. So when we look what's in breast milk real quick, so there's sort of the main constituents that they're, just like any food, proteins, carbohydrates, and fats, just like they call them the macronutrients, just like any food. And so the proteins in breast milk are mostly whey protein. So just like with a cow's milk, you sort of separate out into whey and casein. Casein is like the curds. The whey is the more soluble fraction of protein. The protein particles are smaller. They're easier to digest. They foster more rapid growth. Casein, those proteins are larger. They're slower to digest. They have less of these type of what's called branch chain amino acids, which are needed for rapid growth. Anybody who's been around baby puke knows that the casein, it's more likely to curdle. And so you can find sort of this curdled milk as one of the common things that a baby will spit up. And early breast milk, interestingly, is 80% whey protein and only 20% casein. This is obviously early human breast milk. So it's the perfect food for immature digestive systems because you get those proteins that are easier to digest. You get the ones that empty the stomach quicker. And so it just kind of makes sense when you look at that infant's early digestive tract. And then as that infant matures, the later breast milk becomes about 60% whey and about 40% casein. So they can go longer in between feeds. Their tummies stay fuller longer. They're still getting all the nutrients they need to grow, but they have a more mature digestive system. So again, generally breast milk is going to vary between 60 and 80% whey protein, less casein. Versus cow's milk, when you look at it, straight cow's milk is 20% whey and 80% casein. It's completely the opposite. And the type of casein is different. It's called alpha-1 casein, which can be more allergenic. It can be a little harder to digest. And so cow's milk, human milk, not the same thing at all. Even goat's milk, because everybody's like, oh, what about goat's milk? Well, goat's milk, whereas it is a more similar type of casein protein to human milk, it's what's called A2 or alpha-2 casein. It's still only 20 to 30% whey and 70 to 80% casein. So again, the opposite of early breast milk. So again, not an optimal food for an infant. And so there's a few other kind of subtle differences, but as far as like other proteins that are in milk, there's a protein called lactoferrin, which is an immune booster. It definitely helps to prevent infections in that child. That's in a decently high proportion in the in breast milk. And then other proteins are things like white blood cells, antibodies, other immune proteins. Again, that breast milk is designed to try to keep that baby healthy and to try to help prevent infection. And, again, with some of these things, there's no way we're probably for the foreseeable future going to be able to replicate all the things that are in breast milk in an infant formula. But we're looking at more and more of these things to try to figure out how we can keep advancing formula. Because there's other things like growth factors for the brain, for the gut that are included in breast milk that would be pretty hard at this point to synthesize and put into a formula, but just add to the other benefits of breast milk. So as far as carbohydrates in breast milk, lactose. That's pretty much it. So 40% of the total calories of breast milk is lactose. And there's another one that's a non-digestible carbohydrate in breast milk called HMO, or human milk oligosaccharide, which is the Mac Daddy of all prebiotics, meaning it's the perfect food to feed the growing infant gut microbiome, which is super important for a whole host of reasons. That's a whole nother talk. But that microbiome, it's important for everything, for the gut development, for the immune system development, for brain development. It makes all these compounds that actually are powerful, positive epigenetic programmers for our body. So when you look at the third largest component of human milk is this prebiotic called HMO. So you got to figure Mother Nature's not stupid. If the third largest component of breast milk is this prebiotic to feed the infant gut probiotic bacteria, that gut microbiome, then obviously super, super important. So, it should speak to every formula. Infant formula needs to have prebiotics in them. And a lot of them don't. I mean, we're closing the gap, but it's like, well, that doesn't make sense. So if we're really looking to Mother Nature and the wisdom of putting a really high amount of prebiotic compounds in the breast milk, then we need to be mimicking that when we're making formula. So here's another super important point. Mother's milk does not normally contain any fructose, any sucrose, which is table sugar, or even much if any significant amounts of glucose. So the only sugar that's in breast milk is typically lactose. So we really should be trying to keep that in mind too when we're thinking about if you need to formula feed and we're trying to match breast milk, it shouldn't have some of those other things in them, those other sugars in there. However, if a mom while she's lactating, is eating a lot of sugar, if she's drinking a lot of soda, she can actually sweeten up her breast milk. Like she'll start putting out fructose in that breast milk. Especially with things like high fructose corn syrup and things like that. And that is very likely not good for that child because they can't metabolize it that well. It changes the gut microbiome. Your body actually does not use, and especially a baby's body, does not know how to use that fructose for energy. And it may sort of help to program them for future development of type 2 diabetes and other metabolic associated disorders. So something to avoid. Mom should not be eating a lot of sugar when she's lactating, nor should we be having these other sugars in an infant formula unless there's really no other choice, which we'll talk about this in a minute, but there's a complete and total myth of lactose intolerance in babies. It's really a marketing ploy. The reality is, you can look this up in the medical literature, that only really maybe 1 in a million babies is lactose intolerant. Because why would a baby be lactose intolerant to the main carbohydrate source coming through breast milk? It doesn't make sense. And so, all these formulas that are like the sensitive formulas and things like that take the lactose out, I think they're really kind of missing the mark. So again, something to keep in mind about the sugar factor, that lactose really is the main carbohydrate source for infants. So then we look at the fat content, and this is one of the most variable contents of breast milk, and we'll kind of mirror what that mom's dietary intake of fat is. So interestingly, babies are keto before keto was cool. Babies are typically, breastfed babies at least, are in a mild state of ketosis all the time because mom's milk has up to 10% of what's called MCT, or medium chain triglycerides, which are this type of fat that if anybody's gone keto or knows anybody who's doing the ketogenic diet, they usually are taking MCT supplements, coconut oil derived supplements, and these types of fat generally turn into ketones very quickly, which is a great alternate energy source for the brain and for other organs of the body. And this mild state of ketosis actually fosters and favors healthy brain development in infants. So that's also something to keep in mind when we're looking at formula. It's like, a healthy breastfed infant is in a mild state of ketosis almost all the time because of these MCTs. So there obviously has to be some advantage to that if it's, sort of being handed from the mother to the child. So the infant also absorbs a lot more of the fat that's in breast milk than in a lot of formulas. So the form of the fat that's in a formula is going to matter quite a bit. And there's something called MFGM, or milk fat globule membrane, that's like a delivery vehicle of fats. That's sort of the package deal, like the mom's breast milk will package up these fats in this sort of kind of a clump called MFGM that actually makes it easier to absorb the fat for the infant. And as it turns out, it also fosters neurodevelopment, better gut development. It sort of has these prebiotic effects and fosters growth of good gut bacteria. So definitely some advantages there. So most formulas will use like a non-fat milk as a base and then add vegetable oil to provide the fat content. And it really traditionally did not have much, if any, of this MFGM, but there's formula advances now. They're starting to incorporate this in some of the newer formulas, or they're using whole fat cow's milk, which has some of its own form of MFGM in there, and deriving some of that so that the digestion of the milk is better for the infant. So the different types of fat, again, will vary according to mom's diet. But if she's eating it like more of a Mediterranean style diet, but also eating a fair amount of like fish and some high omega-3 things, then her breast milk is going to have up to 40 to 50% of what's called monounsaturated fat, which is like avocado oil, olive oil type of fat. Maybe 35-40% of saturated fat, which again is not bad. You need that saturated fat for brain development. And then these polyunsaturated fatty acids, which are omega-6s and omega-3s. And this is one of the most variable components of breast milk overall, is how much omega-3 that mom's breast milk has in it. And if you remember me dorking out about this earlier in some podcasts, we cannot use the plant-based omega-3s in our body. So what's called alpha-linolenic acid, or ALA, which you find in flaxseed, chia seed, you'll find it in walnuts, you find it in some other, small amounts in leafy greens, things like that. That's not the type of omega-3 our body uses. Our body needs EPA and DHA, and especially DHA. And these are what we typically think of as the fish oils. These are like, supercharge the baby's brain. Like the baby has that rapidly growing brain, and the tips of the nerve cells that are growing are super saturated in DHA. So clearly there's an important role of DHA in breast milk. And so a mom that's eating a fair amount of fish can have up to 1% of the fat in her breast milk be from this DHA. So for example, moms in Japan where they eat a lot of fish, they'll have up to 1% of DHA in their breast milk. But typically around 0.5% is kind of considered standard on that, but formulas may have way less than that. This has not been sort of standardized by FDA regulations at all. And so some formulas will only have like 0.16%, which is far less than kind of what the European minimum is in their formulas, which is 0.5, and far less from what somebody who's eating a lot of fish might have, which is up to 1%. So it's, again, something to kind of keep in mind. If somebody's looking for a formula, it should, in my opinion, should have upwards of the, kind of the 0.5%, or possibly even a little bit higher. You don't want to go too high because that would throw things out of balance. But again, Mother Nature's smart. If a mom's eating a healthy diet, it's got a lot of omega-3s in there, she's going to pass that benefit along to her child. I think we should be doing the same thing with formula. So as far as vitamins and minerals, it really just I'm not going to go into these in detail, but mom's breast milk has all the vitamins and minerals that you really need to meet the needs of like a 0 to 6 month old child. One of the really important vitamins in there is something called choline, and we talked about this a lot when we talked about pregnancy. So choline is kind of a B vitamin, but it's as important during pregnancy for preventing some birth defects like spina bifida and some other birth defects, because it's one of these methylation vitamins, but also super important for brain growth, and it works synergistically with those omega-3s. So choline is, if a mom is on a low choline diet, like if she's a vegetarian or vegan, which can be very low choline, then that breast milk content of choline is going to go down, which potentially could affect that baby's brain development. So generally a healthy omnivorous mother's milk is going to supply somewhere between 125 and 150 milligrams a day of choline, which obviously you would want the same thing from a formula. So formulas should not be low choline. They shouldn't be shortchanging that. We know from research that moms during pregnancy who get more choline in their diet, their babies have improved neurodevelopmental outcomes. So same thing goes for kind of that ongoing for the first 1,000 days of life. Keep that choline going. It's an important thing for mom to be eating the good choline sources if she's pregnant, which are typically things like red meat, liver, if she's able to eat liver, because that's rich in choline, but it's not high on a lot of people's hit list. Salmon is rich in choline. Eggs are the bomb for choline. So eggs are probably, unless you have an allergy or sensitivity, eating 3 eggs a day will get you to that optimal level of choline intake pretty much. So as far as other vitamins and minerals in breast milk, so iron in breast milk is really low by design. So 0.2 to 0.4 milligrams per liter. So there can be a 30 to 60 fold difference in infant formula content of iron versus breast milk content of iron. So this is something that needs to be looked at much more on a research level, a high level, because more is not necessarily better. And if Mother Nature has low iron and low zinc in that form in her formula, obviously, which is breast milk, then we should really be wondering, like, well, is it necessarily a good idea for us to be pumping a ton of iron into our formula? So this is something that we're needing to look into, which is also why when you're adding complementary foods, they should be iron and zinc rich foods, because the breast milk is low on those by design. So as that child is obviously needing those nutrients for brain development, for immune system development, then the foods should be starting to supply that as their stores are kind of running low at that like 6-month mark. So other things, important is, and I think this is one of the most amazing things. So not only does breast milk have that Mac Daddy of all prebiotics called human milk oligosaccharide, and it's the third largest component of breast milk, but there is it's actually their own breast milk microbiome. So that mom's breast milk will deliver up to close to 1 million bacteria per day from a multitude of probiotic bacterial species through the breast milk. And it looks like there's a process by which the mom's immune system will take those probiotic bacteria out of her intestines, sense what the baby needs, take those important probiotic bacteria out of her intestines and bring it up and deliver it through the breast milk to that baby, which is unbelievable. And so, so even if a baby is born C-section and did not get that sort of probiotic inoculum at birth, then breastfeeding is even more important, because you can really reestablish that healthy gut microbiome by breastfeeding. Again, with the caveat of that being like mom should have a good healthy gut microbiome herself, and potentially consider taking a probiotic, like a multi-species probiotic, if something happened and she had to be on antibiotics or something kind of disrupted her gut microbiome, so that they can really foster this delivery process of those gut bacteria through her milk to the child. Because again, that gut microbiome, that feed the brain, feed the gut, feed the genes, that gut microbiome, super important. All right, what else is in breast milk? So there's things like T cells and antibodies for boosting that baby's immune system. There's something that we talked about, the lactoferrin. There's glutamine, which is an amino acid that is really important for gut development, and also immune system support. There's another amino acid called taurine, which is also important for brain development, neurodevelopment. And is considered a conditionally essential amino acid. There's these things called nucleotides, which are like these little, they're considered non-protein nitrogen compounds that are sort of like growth factors, trophic factors that actually help with growth of the intestines, boosting the immune response. And we're starting to include these in infant formulas. So you'll see things like CMP, UMP, GMP. Those are the nucleotides that, again, through research, we've discovered, mom's delivering these to the baby. They're probably important. So maybe we should think about including these in formula. So this is another variable component. Mom will deliver phytonutrients, which are those, typically we think of as the colorful compounds in fruits and vegetables that have all those immune benefits. They're antioxidants. So if a mom is on a very low vegetable, low fruit diet, she's going to really be limiting the amount of those important protective antioxidant phytonutrients she's delivering, versus if she's eating the rainbow of colorful fruits and vegetables, it's these phytonutrients are then going through her breast milk into the baby, fostering a healthy microbiome, turning on the genes that protect against cancer and diabetes, and also just boosting that child's immune system. So, for that breastfeeding mom, eating a lot of vegetables, also an important thing for the baby. So we won't really necessarily get into there are a lot of barriers to breastfeeding, but more and more hospitals are going to this, what's called the Baby Friendly Hospital Initiative, which is really a series of guidelines to really try to foster the promotion of breastfeeding in the moms when they're coming in to deliver, because you don't want to be waiting till after the fact. You want pre-education. I think getting a lactation consult before delivery is super important, and then having those resources accessible, building a network, because breastfeeding is hard, and especially for a first-time mom, you want to have as much support as possible. So that it's not something where it just becomes so overwhelming that formula becomes just the easy default mode, without really trying to foster, because of all these things we're just talking about, all the important things, the benefits for the baby, to support breastfeeding. So as far as kind of nutrition for the breastfeeding mom, I think continuing to take a good multivitamin, she needs to be eating probably up to 500 extra calories to support that, maintaining her fluid volumes. So just trying to drink like a glass of water with every breastfeed to try to maintain hydration. And then we talked about things like choline, omega-3s, getting enough protein, the whole probiotic foods or supplements if there had been a disruption in her gut microbiome, and really avoiding a lot of the nasty stuff. So this is a time not to go crazy with the highly processed foods, because some of that, those bad fats, the oxidized fats, the some of the super processed seed oils, hydrogenated oils, which are still in small amounts of the food supply, even though they're technically illegal. You don't want that stuff creeping into the breast milk. So you want to try to avoid that stuff. Now is probably a good time also during pregnancy to try to eat organic for those dirty dozen fruits and vegetables. You can find that list on ewg.org, Environmental Working Group. They always post the list every year of the clean 15 and the dirty dozen, so that, unfortunately the mom's body does not filter out all that nasty stuff, the endocrine disruptors, the pesticides, the BPA, the phthalates you get from plastics. So, drinking clean water, drinking out of stainless steel, avoiding plastics, all those things are important for breastfeeding and pregnancy. And again, trying to minimize the sugar thing so you're not sweetening up that breast milk accidentally. So, I think when we kind of look at that overall, I think that should really inform what we are looking for in a formula, because if we're really looking to mimic breast milk, which should be the job of any good formula, then, we would kind of want to follow those rules. And so I'll kind of, we're not going to talk about premature formulas and things like that, because that's different today. And I have a whole kind of course on all this, breast milk and choosing a formula and things like that. But sort of my rough rules of formula, for the, and we won't go too far into like if they need a hypoallergenic formula or things like that. But, first order of business is it should have more whey than casein. So I think for early breastfeeding, for early young infants, having that 80% whey, 20% casein, mimicking breast milk makes sense, and then sort of transitioning over to more of a 60% whey, 40% casein as you go along. And that's what Europe does. Europe has a stage 1 formula and a stage 2 formula that more mimic breast milk going along. For those babies that have sensitive tummies, for the babies that might have some allergies to cow's milk-based formulas, I would say you could also consider starting with what's called a hydrolyzed formula, which are the partially broken down ones. And there's a series of these formulas on there. If you look at the ingredients, it'll list, milk, hydrolyzed whey, or hydrolyzed casein, or hydrolyzed cow's milk. And these are partially broken down, which usually makes them less reactive. And so some babies tolerate these better. There are goat milk formulas that are now being available in the US, and this is just a recent thing because as of like 5-6 years ago, I don't think there were any goat milk formulas that were officially approved in the US. But again, straight goat's milk is not appropriate and can be really dangerous for an infant. So do never feed a baby straight goat's milk, because again, the protein ratios are all wrong. The electrolytes are imbalanced. The couple of the sickest babies I've ever admitted to the hospital as a pediatric GI were babies who were being fed goat's milk, especially the younger infants that were being fed straight goat's milk, and they got super sick. So it's a really bad idea. Goat's milk formula, different story. They will maybe sort of build a formula around the goat's milk protein, just like they do with cow's milk or cow's milk protein, but balance everything else so that it's appropriate for the infant. So I really think in any formula, lactose should be the main or only carbohydrate, if at all possible. Definitely should never have table sugar in there. So the other thing when you're looking at formulas, so there's a lot of times you'll see like corn syrup solids, which is not high fructose corn syrup. So just let's be clear about that. So what corn syrup solids are, they're a glucose or glucose polymer, which is basically a bunch of glucose molecules kind of stuck together that is derived from a corn syrup, but it's not high fructose corn syrup. They actually take the fructose out of it. So it's more of like a glucose or glucose polymer, which again is better than fructose, but not as good as lactose. So again, if possible, lactose should be the main carbohydrate in almost all formulas, because again, that myth of infant lactose intolerance just isn't true. One of my other things that if you can, I am not a big fan of carrageenan. It's a thickener derived from seaweed. Carrageenan, a form of carrageenan is used in lab rats to give them colitis so that we can study rat models of things like ulcerative colitis. So I think it has the potential to disrupt the gut microbiome and cause leaky gut. It has the potential to cause intestinal inflammation in certain forms. So it's just something that makes me nervous. So I generally say like avoid formulas that have carrageenan until proven otherwise. In fact, it's outlawed in Europe. I don't think they're allowed to use carrageenan in their infant formulas. So if it has like coconut oil or something called beta palmitate other than standard palm oil. Standard palm oil can be constipating for an infant and they don't digest it that well. I like the formulas that have higher DHA. I like to, 0.5%, maybe even a little bit higher as long as it's balanced with the omega-6. I don't like the ones that only have, a fraction of that, a third of that. I think you're shortchanging the baby's brain. I think it has to have prebiotics, right? If the third largest component of breast milk is prebiotics, then every single infant formula needs to have prebiotics as a staple foundational part of that formula because of that all-important baby gut microbiome. Should have 125 to 150 milligrams of choline per day. I like some of the ones that have the lower iron instead of the higher iron ones. Historically harder to find in the US, but there are some formulas out there that are not quite as high of iron and still have plenty of iron especially for the term child. So I like it if it can have the taurine, which is that amino acid that can be good for brain growth. Nice add-ons is if it can have the nucleotides and that MFGM, that sort of fat delivery vehicle, since that may have some benefits. So those are kind of my first line things when people are looking for a formula. And if you can find one that's organic, great. That's when we start looking at the differences between U.S. and U.S. and European infant formulas. There are some differences, and they have in some ways stricter regulations than we do right now. But it looks like we are in the process of looking at that and hopefully overhauling things a bit so that we really can kind of keep up with the science. But one of the things with Europe is they don't allow sugar in most formulas. They don't allow carrageenan, and I think it might be any formula. And a lot of I'd say almost all their formulas are considered organic. They actually test for pesticide residues and things like that. The cows are grass fed. So it definitely it's held to a high standard. So, I guess I'll wrap it up because I think we're getting in towards 40 minutes, which is longer than I thought I was going to yammer on for. So anyway, that's kind of my breast milk and formula quickie breakdown. So again, if you know somebody who is pregnant or who is embarking on the infant feeding saga, then please, forward this on to them. And if there's any questions or, I'm also starting to develop some, we're calling it baby boot camp, kind of prenatal and postnatal and nutritional type of programs that incorporate a lot of this stuff in there for the pregnant breastfeeding mom or the formula feeding mom to really try to optimize those first 1,000 days for that child. So you can always get a hold of us here over at Functional Med Associates of Montana. Otherwise, we will, catch you the next time for the next episode. We're still figuring out what that's going to be. And have a great day. And again, don't forget to share us, like us, send us any feedback, and we'll see you next time. The information discussed in this podcast is for educational purposes only. It is not meant to diagnose or treat any medical condition or disease and is not a substitute for medical care. While both of your hosts are licensed medical providers, no provider-patient relationship is stated or implied. Following any health advice, including that contained in this podcast, is at the listener's own discretion and should always be discussed with the listener or their child's primary health provider. Use of any information contained in this podcast implies the listener's acceptance of this disclaimer.